Qualitative and quantitative research questions. There are several kinds of worries and doubts in the universe, or in other words, the seeds of our research ideas that emerge from our practice. As mentioned before, these worries can be refined into research questions in order to be answered through empirical research. There are many different ways to categorize these research questions. It can be according to the type of object, the time span, the methodological approach, or the purpose of the research: to explore, to infer, to measure, to test a hypothesis, or finally to test if an intervention works or not. However, before starting to decide which methodology to use in our research, it is important to understand the nature of these worries and doubts. And a good way to start is by discriminating between qualitative and quantitative questions. In their book, Researching Medical Education, Jennifer Cleland and Stephen Durning state that the differences between quantitative and qualitative research are not solely about how data is collected, the randomized controlled trial versus ethnographic fieldwork, the cohort study versus the semi-structured interview. These are, however, research methods or tools rather than approaches, methodologies. Quantitative and quantitative research comes from different underlying assumptions of what is reality, ontology, and what is knowledge, epistemology. Quantitative research is commonly aligned with positivist perspective, founded on the idea that reality is tangible and measurable. Post-positivism theories, such as critical realism, believe that there is a reality independent of our thinking about it that science can study. On the other hand, qualitative research relies on the premise of subjectivity. Qualitative research is concerned with how the social world is interpreted, understood, experienced, or produced. Moreover, reality is relative and multiple, perceived through socially constructed and subjective interpretations. In practice, these differences mostly, but not only, mean quantitative research equals to hypothesis testing and confirmation, whereas qualitative research equals to hypothesis generation and understanding. In quantitative studies, the process moves from theory to data. It usually, but not always, tests a hypothesis about the effect of an exposure on the occurrence of an outcome. When a quantitative study does not test a hypothesis, it is usually used to describe a phenomenon in society, such as the prevalence of PPE use among adults in the general population, the percentage of patients and their socioeconomic profile who refuse to receive the COVID-19 vaccine, or the prevalence of each cardinal symptom among patients with COVID-19 are some examples of quantitative studies that does not involve hypothesis testing. On the other hand, qualitative research tends to be inductive, building explanations from the ground up based on what is discovered. Its questions and objectives often use words such as how, in which way, for what purpose, in which manner, pointing towards an exploration of the subject. On the other hand, how much, difference, ratio, risk, and relative risks are words denoting quantitative approach towards the subject. One word to be careful with in research is why, as it can imply cause and effect. Sometimes there is a cause and effect relationship between an exposure and an outcome, but sometimes there is none. For example, you could conduct a qualitative study exploring the barriers for the adoption of a procedure or a protocol by a healthcare team. However, it is very unlikely that you will identify one sole reason for this. In the context of the COVID-19 pandemic, if you try to find an answer to the question why some people do not wear face masks, you will very likely ending up having no conclusions at all, or at, and that is very dangerous, having a biased explanation to this phenomenon.